Okay, you ready? Yeah. Alright, well, we're gonna get started on your circumcision today because, well, you've never been circumcised before, so, we're gonna go ahead and fix that for you today, which is important because, when it comes to being circumcised, it helps prevent infection, which is important. And also, the surgery isn't too complicated or expensive, which is a good thing. I'm sure you can afford it, but we're going to go ahead and do it anyways because you requested it, and well, I'm free and had some free time today, so I am going to be here performing your circumcision today, your surgery. So I'm going to go ahead and put on some regular gloves because I got to get the rest of my tools out, and I got to stay somewhat sterile, so go ahead and put these on. No, it shouldn't hurt too bad if I numb it right, which I should. You could always go with a non-numbing route, but you know, it can actually get quite painful and uncomfortable. So regardless, we're going to have to tie you down, restrain you, because we don't want you moving around and screwing up the surgery. So I'm going to go ahead and grab a couple of things. One second. Had to grab a couple of tools from the back room. So, you know, I need my tools. So I'm gonna go ahead and place these out. Gotta get out my scalpel. Also need some scissors. They're actually surgical scissors because I need to, I've gotta snip off the tip of your penis by going into the hole like this and cutting like that, and then pull it back. So gotta get that ready. I have my scissors here. They're big enough that they're small enough that they'll fit inside the tip of your dick, but big enough that I won't have to do tons of little cuts to get it open. So I gotta grab my magnifying glasses because I need to be able to see, and it's just a good idea to do this. Anyways, so I'm gonna go ahead and insert in this mouth gag just because I don't want you to be screaming as easily or trying to shout at me, because shouting at me probably just won't do as well because it's annoying. And yeah, so I'm gonna go ahead and put this in your mouth because you need it. So open wide. Come on, open up. Thank you very much. Sweet. Alright. Alright, that's somewhat comfortable. Okay, good. Alrighty. I'm gonna go ahead and get comfortable. Gotta take a marker because I've got to mark where I'm gonna be cutting. And I also need some rubber bands to cut off the circulation in your penis while I cut. So that's important too. So I'm gonna go ahead and get my surgical gloves on. That one down. So yeah, this surgery should take about, I'd say about 6 minutes, 7 minutes. But you still need to be cautious just because it is your penis. And, you know, that's what you have sex with. So, you've got to be careful, but it's not a complicated procedure. I just got to make sure I cut off the blood flow to your foreskin. Otherwise, you start bleeding, and bleeding from your penis is not fun. So, if you start to move, I may have to hold you down just because you really need to stay still. Alright, I'm going to go ahead, and I'm missing something. Ah, got it, okay. I'm going to go ahead and wrap these around your dick because I need to be able to cut off the circulation, so stay still. Go ahead and wrap this around. Alright, the second one. Second one goes around your balls just to hold them back. So I'm going in. Lift up, please. Thank you. Good. Alright. Now that that portion is done, I'm going to go ahead, take my pen. I'm going to need to hold your dick. That's okay if you're a little hard. It's alright. Alright. I'm going to go ahead and here we go. Gotta make a line here. There we go. Hold still, please. Good boy. Alright, made that line. Alright, now I basically need to stick this probe in the hole of your penis because I've got to pull this foreskin back. And then I'm going to start cutting, so hold still for me. I'm going to grab your penis. Stick this in. Don't feel that, do you? Good, you shouldn't. If you do, I'm not going to numb you anyways, just because I already did that and I'm already here doing this, so. Alright, perfect. There's one. I'm going to set this down this side. I've got to grab my other one. This one's longer. You got to push this all the way at the back of the tip of the penis. You got to be careful though. So, second one. Alright. There we go. Alright, that one's in place. Take out my marker again and make a couple more marks just because I gotta make sure I mark this right. Gotta hold this here. Alright, perfect. Alright, I'm gonna flick your dick a couple times. Tell me if you feel that. Do you feel anything? No. Okay. I'm gonna hold up the bottom and I'm gonna flick here. You feel that? No? Good. Alright, that means it's done. Which is good. Alright, now I'm going to take my scissors and I'm going to hold your penis. And I'm going to start, I've lifted up the foreskin where your hole is, and I'm gonna just start snipping away. Alright, hold still, buddy. There we go. Good job. You have a beautiful penis. Either way, it's gonna look good if it's circumcised or not. There we go. A little further. Oh, I'm gonna hold this up again. Alright, hold on. Alright, here we go. Now I've got to take this I'm going to start pulling back the skin that I've cut. Make it a little bloody, but that's part of the fun. So I'm going to grab one thing from my drawer. Hopefully I've got it in here. Got to remark the area that I cut open, which is important. So this goes there. I'm going to remove the mouth gag from you for 1 second. Alright, how does that feel? The hard part's over, but I still don't want you to look too much just because it can get kind of bloody, as you will see in a second. Let me put one more glove on just because this is the hand that I'm going to be moving all the skin back with. And I need quite a bit of protection because your dick is quite big. So alright, there we go. I gotta check to make sure what time we have here. Give me a minute. Alright, good, we're set. Okay. We've got time. Alright, I'm gonna start moving it back with this hand. So I'm gonna hold. I've gotta take it and move it around. See, it's a little bloody. That's okay. And oh, slipped. Shit. Alright. Just a little more. Gotta hold this again to make sure. There we go. Pull my tip back a little bit. There we go. Yeah, I told you this procedure wasn't too long. Just enough that it makes you uncomfortable though, which I get. And that's quite alright. Alright, next I gotta go back and cut. See if it's a little bloody. It's not too bad though. I'm gonna take this hand. I gotta go back and cut a little further. Alright. We're set with that. Now I gotta take my sutures, this tool, and some of this stitching, and I'm going to take the suture through the stitching, like that. I'm gonna start to stitch up the edge of the foreskin to the shaft of your penis, which is what pulls it back and makes that nice lip, that nice rim around the edge of your cock. So keep still. I'll have to put the mouth gag back in. Alright, we're getting there. I'm gonna take these up. Alright. Looking good so far. It's a little bloody, more bloody than usual, but that's okay. 1, 2. I gotta get this tool. 3. Alright. Pulling the last one through. And got it. Alright. Now I'm going to remove this glove. You gotta take them off this way. Alright, now I'm going to, where is it? 1 second, I gotta get one more glove because I've got to put some more antiseptic on you, on your penis. There we go. One more glove on. We're almost through, buddy. as I put the glove on the wrong way. That's okay. Happens sometimes. There we go. Alright, I got a lube. I gotta put some more antiseptic on you. This is my antiseptic bottle. So I'm gonna take this. See, just rub on antiseptic. So I've got to take this and just kind of get my fingers moist because I gotta take the edge of your dick and rub it around. So here we go. There we go. It's looking better. Still bleeding a little bit. See? Still bleeding just a little bit, but that's okay. Alrighty. And your balls look fine. They were in the way, and I had to move them out of the way. But they're not bleeding. It's just the tip of your dick is bleeding a tad. And I gotta grab this. Just to make sure I've got it all. And you are done. So I'm gonna go ahead and remove my gloves, or at least the surgical gloves. Let's see. Just gonna feel one more time. It looks like the bleeding has stopped, which is good. Yeah, there we go. Alright, it's looking pretty good, I think. So basically, what I did was I pulled the whole of your dick open with my 2 sutures, and then I went in and cut right down the middle, pulled that back to reveal the muscle tissue and the inner portion of your urethra and your, you could look up and see your bladder from the hole that I made. And then I went in. Of course, you were restrained because just it's standard procedure, especially with a male. Well, only with male patients, obviously, but with younger male patients, they tend to get kind of squirmy, and that's not good. So yeah, and then I went in and I peeled the skin back and pulled it back, and then I had to stitch up around the rim, and then I've got to make sure I put an extra cock ring on the end, because I've got to make sure that the blood flow stays somewhat down, otherwise you'll bleed all the way home. So I'm going to put that on. Great. Alright, well, you are done. The cock ring will fall off in about 7 to 10 days, which is normal healing time for the penis. It heals quite quickly. If there's any bleeding, just wipe it with a gauze pad, and don't hesitate to come contact me again. I'll be here, and if you have any concerns, just ask. So, it's really good meeting you. Yep, high five. You did a great job. I did have to be a little forceful, which is, necessary sometimes, especially for you. You were kind of squirming around a bit. But high five, and oh, you hold my hand. Okay. Yeah, I think I did a pretty good job. So, I need my hand back. Alright, thanks, buddy. I will talk to you later, and I gotta go to my next patient now, so bye.